Hello, good evening, and how are you today? I hope you had a productive day, and I hope you're having a good evening. And welcome to this very interesting conversation. Please do tell us where you're watching us from. Shisanga Mbalashi, welcome. Annie Kateve, good to see you. Precious Chinkumba, right? So I hope you are masking up, and I hope you are observing the COVID rules. Yes, I'm sure you may have noticed that COVID numbers are dropping, which is encouraging. If you look at the death toll is dropping, the infections are dropping. We hope that trend continues, and it will continue to drop provided we all do our part, continue to observe the rules, prevention and everything. Remember that COVID is a collective effort, and even in today's conversation you will see that COVID will feature quite a bit as well, because it's an important element, particularly in the condition that we are discussing today, as you will see going forward. So, we were asked to discuss kidney failure. And this is a condition that on this page, I don't think we've dwelt so much on the kidney and conditions that relate to the kidney on this page. I don't think we've talked about them that much. And we've not discussed the kidney a lot, but tonight we are going to talk about a very common disease condition that affects a lot of people, and it arises quite easily actually. Why? Because the kidneys are very vulnerable organs. Now, first of all, let's be very clear on what the kidneys are and what they do, so that when we go to discuss kidney failure, first of all, how it happens and the symptoms and treatment, we are also very clear on those issues. First of all, any human being is born with two kidneys, and the kidneys are on your back, way at the back. That's why I find that if you are doing surgery for the kidney or a kidney transplant or anything, they cut you from the back because the kidneys sit at the back. So the kidneys sit at the back, and there are two of them. They are shaped like beans, like a bean shaped, and they produce urine. So when you're passing urine, just know that there are two kidneys that are functioning together to produce the urine. And it's very important for a human being to pass urine. If you are not passing urine as a human being, it becomes a bit of a challenge, as you will see as we go. And the quality of your urine also matters. And then also remember, on this page, we encourage you to drink enough water on a regular basis. It will now make sense also why that is important. Now, with regards to kidneys, you will find that sometimes some people are either born with one kidney, others have one kidney because they donated their kidney to somebody who didn't have one. And some people have asked, can a person survive on one kidney? Yes, you can. That's why kidney transplant is even possible. You can donate a kidney to a relative, and you should be fine. You know, human beings can survive on one kidney quite well, actually. It doesn't mean that you don't need both of them. You do need both of them, but understand that you can survive on one. Now, what do kidneys do? What's their job? Of course, the commonest thing we see kidneys doing is that they produce urine, and all of us pass urine. But you see, in the process of passing urine, in the process of producing urine, kidneys are responsible for the filtration function in the body. Filtration in the sense that kidneys are the biggest route or route through which waste especially chemical wastes, are removed from your body. So your kidneys are an important organ when it comes to getting rid of water-soluble chemical waste from your body. The liver processes a lot of these chemicals and neutralizes them, and it will produce a lot of byproducts. When the liver produces a lot of byproducts and some waste that come also from the lungs and other parts of the body, the kidney's job is to get those water-soluble waste and get them out of your body. Because when these water-soluble wastes and your kidney is not removing them properly and they accumulate in your body, that is where disease begins to happen. So, in terms of function, the kidney's job is to remove water-soluble waste or water-soluble dangerous chemicals that we produce on a daily basis in our bodies, and the kidneys remove those. The other function the kidneys do, the second function, is that when the kidneys are producing urine or they are removing waste, sometimes they also need to reabsorb some of those useful materials. So the kidneys will reabsorb useful materials as it is also getting rid of waste material. As a human being, you are supposed to maintain a certain level of acid in your blood. There's a level of acid that needs to stay in your blood. And in science, we call that pH. So your kidney's job is to maintain the acid level or the pH in your body. And then also the balance between the things that are dissolving in your blood and the water part of your blood. There's a balance here which we call in medical language called osmolarity. Now, when that balance is not okay, it can cause you problems. And another key function of the kidneys is to maintain the concentration of key elements in your blood. So the kidney, basically, its job is, if you are driving a car, okay, for people who drive cars, you know, the stabilizing bar of the motor vehicle that keeps the car in the road, that's the kidney. The moment that stabilizing bar is not okay, you struggle to keep the car on the road. That's what the kidney does. The kidney keeps you on the road. The kidney keeps you alive. The kidney keeps you functioning. And if the kidney is disturbed, then you see problems. The other function that the kidneys do, the other job is that it is the job of the kidney to maintain your BP in the normal range. Your heart will continue to beat and whatever, but it is the job of the kidney to make sure that your blood pressure is within normal range. That's what the kidney does. The other function of the kidney that needs to be acknowledged is the fact that the kidney also produces certain key hormones. For example, the hormone that is responsible for producing blood is made in the kidney. So we know that blood is produced in your bone marrow. So the bone marrow is the place where blood is produced. But the hormone that is responsible for production of blood in your bone marrow is produced by the kidneys. That is why you find that when the kidneys really fail and you reach like chronic kidney failure, one of the things you will find with people who have chronic kidney failure is that they struggle with anemia. And the reason they struggle with anemia is because when kidneys have reached a level of total shutdown, there's a hormone, okay, called erythropoietin. It comes from the kidneys. Now, your bone health, the balance of the health of your bones, is the kidneys are responsible for that as well. Because it is the kidneys that maintain the ions or the elements that are involved in the health of your bones. So, sometimes find that when kidneys really fail and they reach like end stage, people start having problems with their bones. Okay? And even their heart also has problems when the kidney fails. Now, Now that you have understood the job or the function that kidneys do, let's talk about the causes. The causes. Now, let's talk about the causes of kidney failure. When we are done talking about the causes of kidney failure, we'll talk about the symptoms. How would you know that your kidneys are failed? So now, let's talk about the causes. Now, when you think about the causes of kidney failure, it is a lot easier to break down the causes into 3 categories. And I need you to remember these categories. Remember that the kidneys, they filter blood. So blood comes into the kidneys, it is filtered, and clean blood comes out of the kidneys to the rest of your body. So the kidneys are sitting in the center. So you have blood coming into the kidneys. Okay? So when you're thinking about the causes of kidney failure, you have to think about anything that will compromise the blood going into the kidney. Before the kidney starts filtering, blood needs to reach the kidney. But there are things that can happen that can disturb or block the blood from reaching the kidney. That's one way of thinking about the causes, and we'll discuss the causes that can stop the blood or disturb the blood from reaching the kidney. Another, or the second way of categorizing the causes of kidney failure is when the kidney itself is damaged. So there are things that can damage the kidney itself, where blood flow is fine, but it's the kidney itself which is damaged. Another thing that can cause problems with the kidneys, remember that the kidneys, they produce urine. Now, anything that will block the outflow of urine, such that the urine is not coming out, there's now a backlog of urine, that can also cause kidney failure. So those are the 3 categories of how you think about the causes. So in medical language, we call them, there's pre-renal or pre-kidney causes, and then you have renal or kidney causes within the kidney itself, and then you have post-renal causes. These are causes that are happening after the kidney, and that's how you think about it. So let's go one by one very fast. So when you're thinking about the causes, and we've categorized the 3 different causes where kidney failure can happen. So if you're thinking about the things that can block blood flow into the kidney, you're talking about situations where you have blood loss. So for example, if you are bleeding, okay, when you are bleeding and you go into shock, the blood flow to the kidney is compromised, and when blood flow to the kidney is reduced, the kidneys begin to fail. Okay. The other one is, for example, if you've taken an overdose of blood pressure medication such that your blood pressure has dropped, the kidneys begin to fail. When you have a heart attack, because the pump, which is the heart, is not pumping blood properly, and the blood is not reaching the kidney enough, your kidneys begin to fail. Remember, we are still discussing before the kidney, blood for the kidney. The other one, if you have any heart disease, say heart failure, that is causing the pump not to pump blood properly to the kidney, you have a problem. There are certain infections that can cause an overwhelming infection all over the body and induce what we call septic shock, such that blood flow to the kidney is compromised, you end up with kidney failure. Liver failure, when the liver fails, the kidney will also follow. Remember that. So when the heart has failed, the kidney will also fail. When the liver fails, the kidney will also fail. Remember that. Now, there are certain drugs, again, that can cause problems. For example, say for example you are allergic to something. When you are allergic to something, you have what you call an anaphylactic reaction. You end up with shock, and blood flow to the kidneys is compromised. When someone has burns, say someone has been burnt extensively, that can also cause a problem, blood flow to the kidney. Another very important reason why blood flow to the kidney can be compromised is dehydration. That is why we tell you to drink enough water. Because if you continue getting dehydrated over and over again, you are damaging your kidneys without even realizing it yourself. Now, so apart from things that can affect blood flow, let's now get into the kidney itself. What can cause kidney failure within the kidneys themselves? For example, if there are clots within the kidney itself, clot formation. If you have very high deposits of cholesterol and they are blocking the pipes, the tiny, tiny pipes inside the kidney will fail. For example, another thing that can cause problems with the kidney is if you have infections within the kidney itself. And right now, nowadays, the most important infection you all keep talking about that can affect the kidney directly is this same thing you call COVID. Okay? This coronavirus disease 2019 or COVID-19, it can directly affect the kidney itself inside and cause kidney failure. Another one is autoimmune. Remember we talked about autoimmune disorders where your own body begins to attack your own parts of the body. We call this lupus. Okay? You can have what we call glomerulonephritis, which is due to autoimmune disorders. Now, glomerulonephritis, this is where in the kidneys you have special tubes which are called glomerulus or glomeruli. That's their names. Now, when those tubes get affected, they get inflamed or anything, we call them glomerulonephritis. And that can be due to your own immune system attacking the kidneys. That can also cause kidney failure. Certain medication that you may be on, for example, if you're on chemotherapy, you are on certain drugs like higher doses of, say, aspirin, Brufen. If you take them for too long, such drugs can directly damage the kidney. All right? Now, you have certain toxic things that can damage the kidneys. Like if you work around heavy metals, where you work in your job, conchito, you work in an industry and you handle heavy metals. Those heavy metals that you handle, by heavy metals we mean things like chemicals like mercury, okay, they can directly damage the kidney. Asbestos, okay. Now, other things that can affect the kidneys that we worry about is alcohol. And by alcohol, we mean too much alcohol. If you drink too much alcohol, one of the things that can get affected is the kidneys. So, and then also if you have a cancer and those cancer cells are dying rapidly, the byproducts that come from there can go and block things in the kidney directly and cause problems. And then we've moved from the blood flow situation, blood into the kidney, things that can affect that. There are things that can affect the kidney itself inside, which can cause kidney failure. Now, there are things that can cause kidney failure that are beyond the kidney. And this is where your kidneys have produced urine quite all right. Now, the urine is being blocked to come out. And there's a backflow of urine into the kidney. Meaning that the chemicals which you are supposed to throw out are now still accumulating inside. And these things have to do with blockage. So if you're, for example, someone has a cancer of the bladder, if you have kidney stones, you can block the outflow of urine. If you have cancer of the cervix for women, that is why we always insist for ladies, go for cervical cancer screening. Because you don't want the cervical cancer to advance, because if it does, it can easily complicate into kidney failure. All right? If you have colon cancer, if you have prostate cancer, this is why we tell men to go for screening for prostate cancer, because if it is not properly handled, it can block the outflow of urine and cause kidney failure. An enlarged prostate. You remember, if you have a very big prostate, even if it's not cancerous, but if it's big enough, it can block the outflow of urine and cause kidney failure. Okay? Sometimes if you have nerve damage. Now, nerve damage, we see it commonly in people who have diabetes. So you could be diabetic, and because you have diabetes, the nerves that supply the kidney, the bladder, for example, can be damaged, and then you have a bladder that is unable to contract to get rid of the urine, and you start accumulating chemicals in your body and causing problems for yourself. All right. Now, what are the symptoms? How do you know? How would you know that, doctor, I think my kidneys have failed, or your patient and symptoms of kidney failure? Now, the symptoms of kidney failure depend on the type of failure that you have. There's what we call acute kidney failure and chronic kidney failure. The features are slightly different. Acute kidney failure is very dramatic, and the damage to the kidneys happens very quickly and over a few days. And when the kidney damage is quickly and over a few days, you'll find that because people accumulate a lot of toxic chemicals internally, they start having serious problems. One of the things you will notice is that the patient may reduce the amount of urine that they are passing. But sometimes urine outflow may be normal, but generally speaking, the volume of urine that's coming out is reduced. That's how you tell that this patient, the kidneys may have failed. And then you begin to swell. Remember that the job of the kidneys is to remove water. As human beings, we lose water through talking. The way I'm talking here, I'm losing water through the mouth. We lose water through sweating and through stool. But the biggest route through which we lose water is passing urine. Now, if the kidneys are failing and you are failing to pass the urine, the water begins to accumulate inside you and you begin to swell. So your legs begin to swell, your hands begin to swell. If you find the patient where in the morning their face is swollen, and as the day goes by, the swelling on the face begins to get better, that's a sign that someone has kidney failure. In the morning, they wake up with a swollen face. But as the day goes by, the swelling on the face begins to reduce and getting back to normal. That's a sign of kidney failure. So, swelling of the body. Why? Because you are accumulating, still retaining a lot of water. Shortness of breath. Now, the reason a patient with acute kidney failure or chronic kidney failure may have shortness of breath is because the water that you are failing to get rid of can also go and sit in the lungs. And your lungs become packed with water and you start failing to breathe. Okay, why? Because the lungs are full of water. And the reason the lungs are full of water is because your kidneys are failing to flush out the water. That's why you find those things. And then someone with kidney failure also, you find that they get tired easily. The reason they are getting tired easily is because the lungs have been compromised because they are full of water. The same urine that you are passing and taking for granted, when you have kidney failure, that urine, instead of coming out, it begins to stay inside you. So the urine continues to build up inside you. Okay? And then because of chemicals now that have remained inside, the patient begins to get confused. And the reason they're getting confused, it is because those chemicals that you're supposed to urinate are now going to the brain and starting causing confusion. So the patient becomes confused. And because of that, they start getting nausea and vomiting and general body weakness. Why? Because these chemicals now are now affecting different parts of the body. And then the heart gets affected by the same chemicals that you have failing to get rid of. And the heart begins to beat in a very funny way. And because of that, if you're not careful, the heart can even stop. Okay, and that's why you find that patients who have kidney failure, one of the things they complain about is chest pain. And the chest pain is because it's the heart which is being affected. And depending on how severe the problem is, because of the chemicals that you're accumulating and the brain being affected, a patient with kidney failure may start fitting. Okay, they'll start fitting, start convulsing. All right, and as they are fitting, if you're not careful, they may get into coma, and when they get into coma, if nothing is done, that's it. They'll sleep forever. They'll sleep forever. So, those are the problems you have. And if you check the symptoms of kidney failure, they are related to the functions of the kidney. Now, In addition to everything I have told you, those are the things you find if someone has what we call acute kidney failure, but there's what we call chronic kidney failure. A patient who has chronic kidney failure, the disease develops at a very slower pace and the damage is permanent. So how does chronic kidney failure come about? Chronic kidney failure comes about when you fail to identify acute kidney failure and treat it. It can progress into chronic kidney failure. When it progresses to chronic kidney failure, these are patients who are always swollen from the legs all the way up. They are swollen. The reason they are swollen is because they've accumulated water. These are patients who, the kidneys themselves, they can even shrink. And because the kidneys have shrunk, one of the functions that get affected, remember I talked about the hormone that the kidneys produce to make blood. When they get to chronic stage, that particular hormone stops being produced. And as a result, the patient begins to have what we call anemia. And the reason they're having anemia is because there's a hormone from the kidney that will stop being formed. And because that stopped being formed, the patient will start having anemia. Now, we also talked about the kidney being responsible for regulating your blood pressure. So when you end up at the chronic stage of the kidney failure, because the kidneys are now unable to control your blood pressure, you end up with severe hypertension. So the kidney has a very weird relationship with hypertension, because when the hypertension is not very well treated, it can cause kidney failure. And when the kidneys fail and they reach a chronic stage, chronic kidney failure can cause hypertension, high blood pressure, because the kidneys are now failing to control the blood pressure. And it becomes a vicious cycle. Okay? That's why I find that a patient who has chronic kidney failure, one of the things they have problems with is the health of their bones. So, you don't want kidney failure to progress to chronic. You don't. All right? Now, what are the risk factors? Now, whenever you hear risk factors, even here when we are discussing risk factors, pay close attention, because it is in the risk factors that is where prevention also is. So when we are telling you the risk factors, not the causes, risk factors, we are just telling you that these are the things you need to take care of to prevent something from happening. So for example, right now we are about to discuss the risk factors for kidney failure. We are simply telling you, pay attention to this list, because these are things you need to take care of to prevent yourself from getting kidney failure. When a patient is hospitalized, so any patient who is admitted with a very serious illness, any health worker needs to pay attention to the kidneys, because they can easily fail. The reason patients who are hospitalized end up with kidney failure is because of lack of water. That's why I find that a patient who is in a hospital, they are put on drips, and doctors are always checking how much urine the patient is passing, because they are worried that if they don't do that, the kidneys may fail. So a patient who is hospitalized is at risk of kidney failure. That is why if you are a health worker, you are listening to me, you have a patient who is hospitalized, pay attention to their kidneys, because they are at risk of failure. Age. As you grow older in age, it's a lot easier for kidneys to fail. Part of the reason is that you don't take enough water. Okay? Now, one of the risk factors for kidney failure is diabetes. Now, with diabetes, if your diabetes is well controlled, you have no reason to worry about kidney failure. But here is the situation where it becomes a big problem. It is if you are walking around and you don't know that you have diabetes. Okay? This is why we always encourage people to check their blood sugar. Check your blood sugar regularly. Go and see your doctor near you and check your blood sugar. Because you need to know whether you have diabetes or not. Because if you don't know, chances are the diabetes is eating away your kidneys and you have no idea. High blood pressure. This is why we also encourage people to check their blood pressure from time to time. The reason high blood pressure is called the silent killer is because it destroys the kidneys if it is not controlled. That's one of the risk factors. So to prevent kidney failure, You need to know whether you have high blood pressure or not. And if you do, get those medication, be on treatment. Don't listen to people who tell you that if you're on high blood pressure, you shouldn't be taking your medicine because you'll be on medicines forever. No, don't listen to that kind of conversation. Be very careful with people who tell you not to take your medicines, especially if you are hypertensive or especially if you are diabetic or both. Be very careful. You never know what their intentions are. Maybe they want to inherit your house. Just be careful. Because those are the risk factors, high blood pressure. The other risk factor for kidney failure is heart failure. So if a patient is diagnosed with heart failure, just pay attention. If you need to manage the heart failure very well, because if the heart is not working very well, it can very easily lead to kidney failure. So be very careful with patients who have heart failure. And also, any patient who has any type of kidney disease of any kind, you're talking about glomerulonephritis, kidney stones, those types of things. Just be very careful with those because they can cause kidney failure. And any patient who has liver disease. The commonest cause of liver disease in Zambia is alcohol, especially young people. Moba. Okay? Alcohol. And then lastly, the other risk factor is if you have any cancer. So if you're treating a patient for any type of cancer, just be very careful that the kidneys may be at risk. Okay, the other risk here that you need to pay attention to is dehydration. You people are in the habit of not drinking enough water. We're not saying drink too much water, but we're just saying pay attention to how much water you need to take in a day, because you are protecting your kidneys. Now, if kidney failure is not treated, what's the worst that can happen? Number one, we talked about fluid buildup, where you have so much water in your body because you are not able to urinate it, it will keep accumulating and causing you failure to breathe. Okay? We talked about the issue of chest pain. Chest pain is because it's your heart which is failing to function, and usually when kidney failure is not well treated, the worst thing that can happen is that the heart can easily stop anytime. It can just stop. Okay? So, be very careful. And the other thing that can happen is you may have general muscle weakness, and the worst thing, of course, is death. All right? Prevention is related to the risk factors that I talked about. So just pay attention to those risk factors. It will really help you with prevention. Treatment. Now, with regards to treatment of kidney failure, when it is suspected or your doctor suspects that you have kidney failure, they'll carry out a number of tests to confirm the kidney failure. When it is confirmed, the first thing your doctor would want to find out is why. Where is the cause? Because with kidney failure, if you can identify the cause and deal with the cause, acute kidney failure is, generally speaking, reversible. It's a very treatable thing. It can be reversed depending on what's causing it. So if it's a blood flow to the kidney that is blocked by one reason or another, if you take care of the blood flow problem, your kidneys may be revived. Remember, we talked about someone bleeding so much. If you give them, water or something, either through a drip, particularly through a drip, and you boost up their blood pressure, the kidneys may be revived. If there's something which is affecting the kidneys directly itself, say for example there's an inflammation there, if you put them on steroids, the kidneys may be revived. If there's a blockage, you just have to remove that blockage. Otherwise, if something is blocking the outflow of urine, if you don't relieve that blockage, the kidneys will have a problem. But here's the issue. There are situations with the kidney such that when the kidney fails, certain things become an emergency. Remember, I talked about the kidney maintaining the pH or the acid level in the body. When the kidney fails and the acid level becomes too much in the body and you end up with what you call acidosis, then you need to go for agent dialysis. It's the only way to save your life. So they'll take you for agent dialysis. Why? Because the acid level in the body is too much. So because when the acid in the blood is way up, they have to take you for dialysis. The other reason is when there are certain chemicals that may accumulate in your blood. For example, there's a chemical called urea. The same urea used for fertilizer. It can easily accumulate in your body. Why? Because you are failing to pass it out. And if that is so high and starts causing you problems with your kidney and you're failing to breathe properly, they'll take you for dialysis. Okay? They have no time to wait. That's an emergency. The other reason they'll take you for dialysis is if, remember I talked about, because you're failing to pass urine, so water is accumulating in your body. So you have so much water, you're even failing to breathe properly, they have to take you for dialysis to remove that water. Or you have kidney failure, and the chemicals that are accumulating have now affected your brain. You are either confused or you are in coma, they have to take you for dialysis. Now, what is dialysis? When people talk about dialysis is basically an external kidney. It's a machine that sits there and it's nothing but a big artificial kidney. So a dialysis machine is an artificial kidney. So they'll go and connect you to that machine and it will be doing the job of the kidneys while your kidneys are trying to recover. So if it's acute kidney failure, the reason they are putting you on the dialysis machine is because they want the kidneys to rest and recover, and the machine is doing the job of the kidney for you. That's what dialysis does. So dialysis, when someone has acute kidney failure, it is supposed to help you with reversing the damage and reversing or helping the kidneys to recover, depending on the cause. Now, those are the indications. There could be others. Those are some of the reasons why they'll put you on emergency dialysis. Now, there are times when dialysis is recommended for you because it's not really emergency, but you need it for your survival. It is when you have chronic kidney failure. Now, understand this. When you have chronic kidney failure, we are now saying that your kidneys are so damaged that left to themselves, they will not recover. They will not get any better. That's what we say, chronic kidney failure. Now, in chronic kidney failure, the role of dialysis is basically to, how can I put it? It's not intended to reverse the damage of the kidneys, no. The job of dialysis in somebody who has chronic kidney failure is to put you on an artificial kidney as they are waiting for a kidney transplant. So they can put you on a machine, or there's that other dialysis they do in the abdomen where they put a bag in the abdomen and tubes. It's called peritoneal dialysis. So my dialysis is there's hemodialysis where they put tubes in your blood, where blood comes out, it enters the machine and comes back into you. Peritoneal dialysis is where they put tubes in your abdomen and with a bag, and that bag helps you with removing some of the toxins. So now, dialysis for somebody who has chronic kidney failure, understand this. It is not intended to reverse the damage. Dialysis for somebody who has chronic kidney failure, the job is to buy you time until you are able to find a donor for transplant. Peradventure, in some people, depending on what caused it, they may get better. But otherwise, when someone reaches the end stage, what we call end stage kidney failure, they become dependent on dialysis. Okay, they will stay there for some years, but otherwise, the solution is kidney transplant. Okay, that's the solution. It's kidney transplant. So somebody who is on end-stage kidney failure, they will be on dialysis for some time, but the final solution is kidney transplant. Okay. Now, In between, when you're managing a patient who has kidney failure, there are a number of things that can go wrong that you need to fix. Now, those things are outside the scope of this conversation. Now, at that stage, now I'll start be talking to health workers who are here, and it will become a very useless conversation for most of us. The whole idea here was to just bring you up to speed on what kidney disease is, and bring you up to speed on the risk factors, bring you up to speed on the causes, bring you up to speed on how to prevent it. Now, let me tell you a very, very, very common cause of kidney failure in Zambia. I've noticed that there are people who are watching us from other parts of Africa. I don't know what happens in your countries, but let me tell you something. Here in Zambia, in Lusaka particularly, one of the commonest causes of kidney failure in this country is people who like taking herbs that are not properly put together. Concoctions that you like taking. These sunko, beetroot sweets, these things you like drinking, tomopole, G, shan, those things you like. Be very careful with who is giving you what herbs. The commonest cause of kidney failure, let me put it this way. Okay, there I'm exaggerating a bit. Let me say it the correct way. One of the commonest causes of kidney failure in this country is a herbal medication which is administered by unexperienced people, or people who are not very sure of what they are doing. They are destroying people's kidneys. Of course, in addition to the liver, but the kidney is more vulnerable. So my message to you, one of the risk factors for Zambia particularly, is herbal medication. These are unscrupulous herbal medication. Mwana peruke, pwanya something. Those things you like taking, they are the commonest causes. So bear in mind. Bear that in mind. Be very careful with these herbs you like taking. Be very, very careful. Because your kidneys are vulnerable. Very vulnerable. Okay? Now, what time is it? I've talked non-stop. This is a long topic. This has been Dr. Mjajati discussing kidney failure with yourselves. And I hope after this conversation, you will have some idea and you will have a working knowledge of how to prevent kidney failure, how to look after your kidneys, and how to remain healthy, and also how to identify if someone has kidney failure. And also I've touched a bit on treatment. I didn't go into details. I thought I'd just give you an idea on those issues. If you want to really, there are some things you want to clarify, just replay this video all over again. And, you know, if you have any clarification, you can always get back to us. Now, do us a favor like you always do on this page. Share this video. Remember, our mission is to bring this information to everyone, as many people as possible. We need as many people as possible to be making informed choices about their health. Share this video. Share. It's the least you can do. Share it. All right? That said, do take care and good night.